In our research, we have seen some real interesting shifts in terms of how employers are prioritising their health benefits and how they're reacting to health. So they are looking at immediate issues, conditions, musculoskeletal, mental health, cancer. But what we also saw in the research is about a third of the respondents are really concerned about lifestyle choices. And there's such a huge knock-on effect of a poor lifestyle choice now and what's going to happen to health in the future. And this is concerning not just employers. In fact, we see it in governments and societies worldwide, knowing that being overweight or unfit and the knock-on effect of diabetes and cancer and cardiovascular coming down the line, that creates a really big people risk. So the big shift is employers focusing on prevention now, putting in place health assessments to get the data of what they could preempt. And I think that's going to be the direction of travel and a real focus for employers over the coming years. The digital world is really changing health and wellbeing practices in a quite incredible way, right from those clinical interventions through to wellbeing challenges. So in our research, we found that about 3/4 of people are saying that using virtual GPs has had a medium to positive impact on the health outcomes within their workforces. Even higher when it comes to digital access to a consultant or a specialist, that speed of access to getting the treatment that you want is really shifting the dial. And although it's very early days to see the data coming through from the insurers, already you can see some of the group risk insurers looking at their numbers and saying it's starting just to bring the costs down because people are getting faster access to a consultant because of a digital tool. They are getting treatment earlier, perhaps at stage 1 or 2 if it's cancer, for example, rather than when they've got worse symptoms at stage 3 and 4. Therefore, the treatment is easier, it's more effective, and it costs less as well. So really powerful of what this could do for your employees, but also as an employer looking at those future risks and conditions coming down the line. The most important advice I can give to employers to future-proof their health and wellbeing strategies is get to know your data. As a benefits manager, as an HR person, you know you've got people risks coming down the line, and that's going to affect your HR costs. You know there's inflation out there, you know there's medical trend. So your pricing is going to, and your costs are going to go up and up. But if you know your data, you can get evidence today to preempt and mitigate costs in the future by knowing what health conditions are within your workforce. By understanding what's going to lead to certain conditions, you can put your business case together. So we are seeing that over 90% of our respondents to our research actually want to improve the sophistication of the analytics of the data they get hold of. And that is going to be vital to justify the programs you want to put in place now for your employees that will help you in the future.